Welcome to Happy Homes and Gardens. I'm your host. My name is Daphne Royce. I am a real estate broker, architecture, and interior designer. SFGate has just named Dr. Carolyn Chang a 2024 the Best of Bay Area winner in the category of cosmetic and plastic surgeon. What exciting news! Let's congratulate Dr. Chang and learn about her work in cosmetic and plastic surgery. Hello, Dr. Chang.
Hi, and thank you for the compliment. I appreciate it and happy to be here.
Please tell us about you and how you became a plastic surgeon.
Well, that was a long time ago. It feels like yesterday. So I come from a family of a lot of scientists. And so I've always had a big science background. And when I came to college at Stanford in the Bay Area, I thought I would study sciences. But as I got into the field, I realized that I wanted to interact a little bit more with people and not just do basic science research. And so then I shifted my attention to something a little bit more applied, like medical school. And it appealed to me. I did some rotations when I was a student, and I liked it. And so I applied to medical school, and then I went to Stanford again. And during that time, in school, the way it works is the first 2 years are all studies, and the second 2 years are clinical. And so during the time of the book time, the first 2 years, the school will assign a mentor for you so that you don't lose complete touch with the clinical aspects of medicine. And my mentor happened to be a woman plastic surgeon. She was on staff at the time at Stanford, and she was the only female plastic surgeon on staff as well. And she was a great influence to me. She took me into the operating room. She showed me how to scrub. She showed me what operations look like. She let me participate, actually. And after that, I was hooked, and that's how it happened.
At that time, there's a lot of women plastic surgeon.
That was probably about almost, gosh, I'm going to date myself, but maybe almost about 25, 30 years ago. And so, no, there were definitely a lot less. Nowadays, there's a lot more. There's a lot more women surgeons. There's a lot more women, everything, actually. Internists, radiologists. Women are actually over 50% of the medical school populations now, but not back then. Definitely not.
What was the reason? Because the curriculum was taken too long, or because just
I
not
think,
popular for women?
yeah, I think there was a lot of that. Nowadays, the medical schools and the training programs are much more accommodating to maternity leave. I think, I don't have any experience with that because we couldn't miss any days. So I'm not sure how they're structuring it, but I think it's more friendly to people who want to have a little bit more of a work-life balance.
You have been in plastic surgery for decades. Have the cosmetic plastic surgery industry grown or advanced in the past 30 years?
Well, 30 years is a long time, but it's actually a short time in the sciences. And so things in medicine happen very slowly. But luckily, in the field of cosmetic surgery, it's been quite remarkable. I mean, when I did my fellowship, I did a fellowship in facial cosmetic surgery. And at that time in the office, the only injectable we had was collagen. And that's what people used for fillers. Botox was just starting at that time. This was, in the late 1990, I think it was around 1999, 2000, something like that. And so we really had very little in the way of non-invasives. And I think that has probably, I think, universally, we think probably that has been the biggest change in the field of cosmetics is all of the advent of the millions of different kinds of fillers and injectables, laser treatments. All of that entire non-invasive industry was non-existent when I first started in training. And so that's been quite remarkable. And as a result, also, I think just the applying the technologies that we now have has also opened up improvement in our techniques in the surgical side as well. And then also, just in terms of evolution of surgeries, natural evolution of surgeries has occurred, and it occurs slowly, but there have definitely been advancements in minimizing bleeding, expediting healing, minimizing scars in surgery, and maximizing outcomes. So all of that has happened over the last 30 years. It's quite exciting.
And I know they starting getting popular because this is TikTok, this is social media. Do they change how people think their appearance?
Well, it's funny because I think the technology, the social media, is definitely part of the advancement of cosmetics and plastic surgery as a whole. Over the just in terms of the exposure that it gives to everyone. Because before, in my fellowship, nobody advertised anything. Everything was word of mouth. People came in one at a time, and everybody wanted to be completely secret, and nobody talked about having surgery, especially facial surgery. So it was all very hush hush, and it was very specific populations, really. And now with the advent of TikTok and social media and Instagram, especially, it's now being a widespread topics of conversation for all ages and all demographics. It's really democratized it for people. And then also people are much more open about having procedures. There's not a single day that you don't read about someone fixing their breast implants or having lip injectables, or some doctor analyzing what this celebrity has had done or not done. There's so much discussion about how we look and how we get how we look. And that's really opened up the world of knowledge for people. Also, I think the non-invasive procedures have really empowered people to take control of how they look. And I think it's allowed them to feel more confident about doing things proactively. And so all of those things have really been a benefit to just understanding and knowing what your options are. And social media has definitely been a huge part of that.
We should have more beautiful people.
It's never a bad thing to look good. That's what I think.
So how young is too young to start cosmetic treatment or plastic surgery? If so, what are other possible side effects?
Well, I definitely have feelings about that, and I may not share that with all plastic surgeons, but I find that they're doing an elective surgery in and of itself is a very serious undertaking. And so even though we're exposed to it all the time and we read about it all the time, it's still a surgery. There are a lot of risks. There are a lot of long-term potential side effects and things that you may not be aware of. And when you're young, there's a couple of things that are, I think, a disadvantage to having a good experience with plastic surgery over the long term, especially. One is, a broader perspective, a longer term perspective of what you are like as a person and what your values are and what your goals are, just in general. And so I think there's an emotional, mental maturity that needs to occur when you're doing an elective procedure, because you're making an elective choice that's going to impact you in some way for the entire future of your life. And then the other thing is that simply there are physical things that haven't developed enough. So we do have ages for when we think that breast surgery would be appropriate, because you shouldn't do breast surgery for purely elective reasons, barring congenital defects very young, because your breasts just haven't developed fully. So I think that would be irresponsible. And then also things like liposuction. Your body hasn't developed fully, and that you'll at age 17, 18, your body's going to change a lot over the years. And so what you do in terms of liposuction, i.e. changing the density of your fat in certain areas, is going to impact you for the rest of your life, because you won't stay that weight definitely for the rest of your life. So there's a lot of both developmental and emotional aspects. And so I really hesitate to operate too much on teenagers. I think that people really need to understand themselves better before they can make these kinds of choices.
Do you think we will have a technology going forward and be able to reverse the side effects?
I think there's a lot of things we can do. So it's not all bad. If you have breast implants early, there's definite things that you can do definitely to adjust them as you get older. In fact, we expect to do revisions of breast surgery. If you have areas of too much fat taken off, there is fat grafting that's available. But in general, a lot of things are not reversible. This is not really the topic, but a lot of the population is entertaining the idea of transgender surgeries. So some of those, particularly the genital surgeries, are not changeable really. And so these are very serious potential outcomes that you have to consider, especially if you're starting at a young age.
I also have a question about non-surgery procedures, such like laser or Botox. Those are common.
Yes.
Would they have a side effect?
Well, they can actually. Just because it's not invasive doesn't mean that that it doesn't affect you as seriously as surgery. Surgery is definitely more invasive, but non-surgical things can definitely do things. So, for instance, for fillers, it's now sort of a hot topic to discuss how when you have repeated fillers, particularly in your lower lids, you can actually cause puffiness in the area, what we call malar bags, and get swelling that's persistent. So that's been a side effect that people were not as aware of before. And so there's a whole subfield as to how to treat that now. And that involves a lot of times dissolving the fillers. When you apply energies to your face, the idea is that you're actually creating scar tissue under the skin. So with Ulthera and Thermage, radio frequency energy, some of the lasers like CO2 laser, they cause damage. And that's why they work, because the damage then causes scar tissue, which causes increased development of new collagen, and it increases contraction, skin contraction. Scars cause skin to contract, and then that is a surface effect of tightening. So that's how they work. But when you apply those energies, particularly if you do it repeatedly, then you're creating a lot of scar tissue in all of the planes of your skin and deeper tissues. And that can sometimes make surgery then very difficult, much more difficult than someone who hasn't had things done. Also, if you have a lot of residual fillers, that can also obscure. If you have threads from thread lifts, there's a lot of stuff that can be lingering in your face that can affect also what happens in the future with surgery. So yeah, you have to be cautious. I usually tell people that the energies can be very powerful tools, but you should use them judiciously for sure.
Interesting. And what are the differences between cosmetic surgery and plastic surgery?
Well, that's interesting because we use it all the time interchangeably, but plastic surgery is really a much larger field than cosmetic surgery. And in fact, cosmetic surgery is only a very, very, very tiny part of it. So for instance, in training, we do very little. I think I did about 3 months of pure cosmetic surgery versus 7 years of the whole field. So, in plastic surgery is truly the essence of plastic surgery is functional, and it's actually primarily a functional restoration field. So, for instance, we do reconstruction of breasts after mastectomies. We do a lot of salvage of body parts, from trauma. So let's say you have a lower extremity injury after a car accident, and you have to have the bones repaired, but you don't have enough skin to cover it because the skin's been avulsed off. This is very gruesome, but it does happen. And so then you have a difficulty covering the bone that's been repaired. So that is very critical to the function of your leg in the future. And so as a plastic surgeon, one of the most basic things that we do is take tissue from other parts of the body in order to salvage the limb, to protect the limb so that it can heal the bone underneath. And that is the true essence of reconstruction. So the majority of the field is really reconstructive. And cosmetic surgery is an application of reconstruction techniques. And the idea is to make things look more, quote unquote, beautiful. And I think that, but because of that, it is completely elective. So cosmetic surgery is just a small portion of the whole field of plastic surgery.
Well, that still sounds a lot of work and
yes.
recovering time.
Yes, it can be, definitely.
As a doctor, what do you recommend for health? Is there any food that we should avoid in our diet, or things that we should do daily for us?
Well, there's a lot of things we should do daily, but I think most people don't do. So, the number one thing obviously is diet and exercise, and that's easy to talk about, but hard to implement. But I think that even just as you get older, it depends on what time of life you are. When you're young, you are very much more energetic, everything works better. And so diet and exercise are not so hard to implement, particularly the exercise part. Weightlifting and very, strenuous cardio can be very good for your overall health, particularly your cardiac status. And then as you get older, you get busier, time may be a factor and you're more tired, things just don't move as well, and you may not be able to do that running. And so what I tell people, the most important thing, I think, honestly, is just to move a little bit. And even if you're not killing yourself, just to even walk. Walking, I think, is an excellent exercise. I think that one of the most important things that you do as you get older, and that's particularly true in my field of work, is stretching and mobility. And I think that is really underrated. I think as you get older, I can't tell you how many women I have that I'm doing a facelift on, and they're on the table asleep, and you have to move the head side to side. The head only moves this much, and it's shocking. They can be in their 50s. And so that's all that tightness back here and stenosis that's occurred over the years. And when you don't do the exercises, you lose mobility. The same with all your other joints as well. And as you get older, it makes it much more possible that you're going to injure yourself when you don't have flexibility. So as I get older, I've really talked to my patients a lot about maintaining flexibility. And that's something that is not hard to do, no matter what age you are. And I think that's super important. And then just get out and walk a little bit and watch what your diet is. I think as far as diet goes, maybe don't concentrate so much on calories and exactly what you're eating, but really pay attention to decreasing foods that we know cause inflammation. So that doesn't mean you can never have ice cream again, but I think moderation is the key.
Do people need to eat less when they get older?
Well, I mean, in the world of dieting, less is definitely more. So I do think that watching what you eat can actually make you feel better. You go on vacation and everybody feels it. You eat 3 meals a day because you want to enjoy yourself and you want to sample what the local fare is. And then before you know it, you don't feel good. So I think it's common sense. Your body's telling you what you shouldn't have in terms of quantity. And if we listen to that, which is very difficult to do when you have apple pie in front of you, but if we listen to what we really, really need to eat as physiologically, then I think that our diets would automatically sort of regulate. It's an interesting thing. I have 2 kids who really like to eat a lot, but it's interesting to me that they just stop when they're not hungry anymore. And so I think that's a real skill that probably needs to be learned by most people.
Okay, that's interesting style. So when they full, they stop. They don't continue to eat.
No, even if it's delicious. It's interesting.
That's interesting. Yes.
Yeah, and whereas I have cats that just won't stop, so it's just, I think it's pre-programmed. I won't stop. So it is. I think it's just something that, maybe it's something that comes from the family. Which sounds very wasteful, but maybe just serve smaller portions and emphasize that it's okay to stop, if you're not hungry anymore.
Well, I have a problem. I always finish my plate. So
right, because I was taught to do that, right?
Yes.
And I think that is definitely a good ethical thing to do, but maybe just serve less to begin with. And I think in America we tend to have bigger servings, and I do think that contributes to the problem. And I think moderation in all of it is the key to success, because you cannot maintain, especially as you get older and busier and more tired and your joints don't work. You cannot maintain those kinds of schedules for the vast majority of people. And then you're hard on yourself, and then you think, oh, I can't do it, so I'm just not going to do it.
That's why you have such good figure.
Well, I work really hard at it. So, but I think that moderation is going to get you pretty far.
So normally who gets plastic or cosmetic surgery the most? Is this related to menopause?
Well, I think there's different age groups that get it. I think the absolute most, and we have statistics of this all the time, it's very general, women get by far the most. So we have new statistics from the American Society of Plastic Surgeons that just came out, and 6% of people are men. So number one group is women, and we've always known that. And then within that, I think everybody's practice profile is a little bit different. But for the most part, I would say the ages of the most plastic surgery that's done is probably somewhere between 30 and 65. And then within each of those groups, you have different surgeries that are most popular. And so if you look at the younger groups between 20 and 30, I think you would say that augmentation and liposuction are going to be the most common. You know, they don't have facial things to fix. So the body is really the emphasis. They're active, they're dating, they're, you know, interested in, you know, social things. And so they want to look good, their figures particularly. And these are mostly women, of course. And so then between 30 and 40, probably the most common things are going to be rejuvenation after kids, because that's the next thing that happens that changes their body. And then they might be starting to look at some early eye things, you know, eyelid things or early facial things, maybe start to do the non-invasive things as well. And then between 40 and 60 then is kind of a big group. And I think at that point in time, you start to mix up into the facial surgeries as well. And so a common time that people really start looking at facial surgery, real facial surgery, is going to be probably mid-40s. And at that time, they may still be cleaning up the effects of pregnancies as well. So you get a little bit of a mixing of the breast and body as you get into middle age. And then the older people, 60 and up, is always primarily facial surgery. So there is definitely different demographics. But if you look at the stats from the ASPS that just came out, the number 1, 2, and 3 procedures are all body. So that's augmentation, lipo, tummy tucks, that kind of thing. And I think that's true pretty much all the time.
What are your most common procedures?
So I did a facial fellowship, actually. So I did a fellowship in facial surgery with the person that, one of the people that invented most of the principles of the modern day facelift. So he's the first of a group of people to really describe how to use the deeper planes of the face in order to lift and then therefore get a more natural result. He helped describe the anatomy and teach how to do it safely. And so as a result, I have quite a large facial practice, which I really enjoy. It primarily is facelifting and eyelid surgery, that kind of thing. And then also my background is in breast and body from my just practice experience. So when I finished a residency, I also did residency at Stanford. I joined 2 other women from Stanford that were in San Francisco at the time. I'm from the Bay Area. And they had a very large, very prominent breast and body practice. The senior partner brought at that time, novel way to do breast reconstruction. And she was the only woman really doing it at any large volume in San Francisco besides the universities. And so we had a huge breast and body, breast cancer, breast surgery practice. And so as a result, it was almost like I did 2 fellowships. And so these days now, my practice is bifurcated. I do a lot of breast surgery, a lot of complex breast surgery as a result of my experiences. And then the other half of it is facelifting. So it's a little diverse that way, but it's because my background is a little bit different than the usual person. And I like it.
So my curiosity, when patient engage with you from consultation to finish the procedures, how long it normally takes?
Takes as long as they need. So some people are very fast. Some people are more thoughtful about their questions because they've maybe seen 4 or 5 other people, or they've been researching, or they're just more type A. So it just depends on the person. But for the most part, it takes about an hour. We usually leave about that much time, and the vast majority of people get everything they need out of that. The consultation process is 2-pronged, really. So we obviously do a medical intake form before. And so we talk about, I do an assessment of your overall health, because this is at the bottom line a medical procedure. And it's the bottom line is elective. And so we have to be sure that you are a candidate actually for that, to do it safely, because that's the number one most important thing is your health. So we do a quick screening of that. And then we talk about what the concerns are. And I usually like to discuss with people. I like a little more background because it helps me to help them if I know what the motivations are. So, for instance, if someone says to me, I'm getting ready to go on the job market, then I know that it's a very distinct reason why they want what they want. And there's a secondary goal, which is a very normal one, but it gives me a framework of where they are and what their reasoning is. And then there's other people that come in and they might say, I'm turning 60 and I really don't like the way I look. Well, then that's a different thing. It's a self-confidence thing. It's a starting a new era. It's more of an emotional feeling. And so that's a different kind of person than the first person. So that kind of motivation conversation I always have. And it gives me a lot of insight as to how I can help that person and what their ultimate reasons are for doing it. And then we talk about the procedures. And so during that time, we, do an exam. And so within the framework of what they want to do, I will give you a number of different alternative choices. And I can give you the pros and cons of each. I don't usually like to tell people what to do because that's not really, it's not the way I run my practice. So for me, the consultation process is really very collaborative because anyone can do all kinds of things, but it's my job to guide you to the best answer for you. So for instance, if someone comes in and they have concerns over their belly, I did this the other day with someone, and they're really a good candidate for a tummy tuck because that's the gold standard operation for getting the best looking rejuvenation after pregnancies. But they really don't want it. They don't want to go through the surgery. They're afraid of the scar. And so then we talked about the alternative liposuction. And I gave the pros and cons of each. And I think that really empowered that person to think about doing something that maybe is lesser, but is more in keeping with their own comfort level. And so that's what we do during the process. And then once we talk about the procedures, we also talk about the risks and benefits and how you plan for it and how you plan for the post-operative course. And then the final thing we do is that the person will often meet with my patient coordinator who is in charge of scheduling surgery, and she'll go over with the financials because that's part of the planning process as well. And so that whole process takes probably about an hour.
Well, I really like your approach. I think that's a healthy way to approach people to make their own decisions.
Yeah, that's also evolved in medicine too, I think, because when I grew up, the doctor would just tell you, and that was it, and that's how my fellowships all were as well. And nowadays, I don't think patients want that. Patients want to be much more engaged in the process, and I think it's healthy. I think it's more informed consent. I think people are happier with their choices.
That's wonderful. There are hundreds of cosmetic products out there. Do we really need them? And do they delay or reverse aging?
Well, it is overwhelming, actually. I get samples all the time, and I don't even have time to use them all. And honestly, I don't really feel like you can tell exactly what a product does until you use it for at least a month. I mean, you really need to see the longer term effects of it. And the little samples are only like a day or two worth. But in general, I'm a big fan of products. I think it keeps people engaged in healthy skin rituals, and it keeps people feeling good about themselves, and it's fun. It's a fun endeavor. But the number one thing that a product needs to do, and it doesn't matter which product it is, it doesn't matter if it's from Walgreens or if it's from Neiman Marcus, is it needs to hydrate your skin. So I'm talking about skincare in particular. And so that has to do with a lot of things. That has to do with the type of makeup of the cream. So it could be oil-based, it could be water-based, how the delivery system is, whether or not it penetrates, the texture of it, whether or not it's something you think you can use. But I think it's really important to get a moisturizer, and that's at every age, because the moisture balance of your skin is what makes your skin look plump and look healthy. And it also prevents it from having unnecessary dryness, which can hurt it over the long term. People with chronically dry skin tend to have skin that looks older sooner. So moisturizing, I think, is a really important thing. And it doesn't matter where you get it or how you get it, or if you use 10 products, one different each day, as long as your skin is adequately moisturized, however it works, is going to be good for it. And then the second thing that's really important, which I have to admit I don't always do, is sunscreen. I live in San Francisco, and sometimes I just think, why bother? It's always dark. It's always gray. But it is really important to protect yourself from those UV rays, and that's 100% true. And so that's important too. And I think those two, plus a nice gentle cleanser that doesn't strip, are the cornerstones to the best skincare that you can do. And then depending on how complicated you want to get, there are little anti-inflammatory things you can do, like acids and this, that, and the other. But the cornerstone is going to be moisturizing and sunscreen, and it's going to help you over the long term, but it's very, very, very small effects over a long period of time. So it's nothing like surgery. But I am a big fan of preventative care. I started when I was about 7 because my Chinese tiger mother decided that I had to have perfect skin because that's important culturally. And I'm glad. I think it pays off in the long run.
You do have a good skin.
Thank you. Most Asian women do because of their mothers. So I think that's one cultural thing that should carry over to everyone.
What are your views on people doing facial spa treatment?
Well, I was shocked to learn that the younger population now, something like as early as 9, 10, 11, 12, they're taking over Sephora and they're using every product in the world. And they're doing all these masks and things. And a lot of kids, I think, are having trouble because their skin is just really reacting to all of these chemicals and things going on, and they actually are having worse skin. So I think that there's a place for all of this stuff, but I think that once again, like exercise and diet, moderation is really the key. So I don't have an issue with using a lot of different kinds of products, but I think that sticking to 1 or 2 at a time rather than 20 is really going to be the best way to protect your skin. And then you can experiment more scientifically. You can compare what's going on, and you can figure out what's good for your skin. And I think those are lessons that only you can do because they're personal.
Do you think we would need to put age limitations on certain products, maybe?
I don't think so. There are some products, though, that do have some toxicity to them. Like things with hydroquinone, there's some toxicity. Now, I think that the doses that people are using in skincare is probably not that great, but maybe over the long term. So I do think you need to be careful about what ingredients are in your actual skincare. I think it would be, I don't think that most products are harmful enough to have age limits on them. And the ones that do need supervision usually are prescription. So I think it's already pretty well regulated, most likely.
That's good to know.
Mm-hmm.
And please tell us, where is your website and how can people contact you?
Well, there's no plastic surgeon in the world that can't be found. So, it's funny. I got into a car accident a while ago, and the guy, I had information. He says, well, how am I going to find you? I said, you can find me. Anyway, so my website is www.drcarolynchang.com, and that's DrCarolynChang.com. And I have an Instagram also, which is great because there are pre and post-op photos, and it has I do a lot of reels, so I like to talk about issues that patients might have questions about. And that is Carolyn Chang, MD. So at Carolyn Chang, MD, and that's Instagram. And we have a photos one that's associated with it. So anyway, I'm in San Francisco, and so give me a call, and I'd be happy to talk to you.
Thank you so much.
Mm-hmm.
Thank you so much, Dr. Chang. That was really a wonderful, informative section that we have in our discussion.
Well, thank you. And thanks so much. I'm so happy to have met you, and I'm so happy to have contributed to this.
Thank you very much, and have a wonderful weekend.
Thank you.